Welcome to the Swain Sinus Show, a physician and patient discussion on how to better manage and treat mild to serious sinus issues and conditions. From diagnosis, treatment, home remedies, and surgery, Stacy and Dr. Swain will talk about improving your quality of life, breathing easier, and feeling better. Let's take control over our sinuses and allergies so they don't control us.
Hello, Dr. Swain.
Hey, Stacy. How are you?
Good. How are you doing?
Good. Glad to be here.
Me too. Well, I have a really important question for you today.
Okay.
This isn't something I've personally dealt with, but I have friends that do, and I'm curious, do you deal with nosebleeds often?
All the time.
Really?
Such a super common event. I see those kind of problems weekly, sometimes daily.
Wow.
People of all ages, children and adults. The big thing when you talk about nosebleeds, I think the biggest thing is the severity of it. What kind of problem are we talking about? We were talking earlier before the show started about the hard thing about nosebleeds is that they're just really inconvenient, and it can strike at any time. I mean, you're walking down the street and you have a nosebleed, or not, I guess. Sometimes people can have it chronically, repetitively. I've had personal experience with nosebleeds. We were talking about that a little bit too.
Tell us a little bit about your memorable nosebleed.
My favorite tie. I lost my favorite tie to a bad nosebleed. Just started out of the middle of the blue. It was self-limited. It stopped, but the damage was done. Blood all over my shirt, blood all over my tie.
Wow. And what were you doing at the time?
I was actually at dinner. It was one of those things. I must have been nervous at dinner, but for whatever reason, I had a bad nosebleed and got it to stop. But once you have enough blood on a tie, it's hard to get out. So,
well, as you say, they can come at you from nowhere, out of the blue, and we're going to get into some more details about it. But before we do, let's talk a little bit about what is the function of the nose, and then we'll go into, what causes nosebleeds.
Well, the purpose of the nose is to kind of warm and humidify the air that we breathe in. We're supposed to be able to breathe just through our nose and not our mouth all the time. And so the lining of the nose is different than the lining of your skin. And so there are a lot of blood vessels and a lot of mucus glands that are in the lining of the nose. And the purpose of that is to trap particles that we breathe in, and at the same time make sure that the air we breathe in is of a proper temperature and has enough moisture to it. And because of that, because they have a lot of blood vessels to the lining of the nose and the tissue is delicate, it can be damaged relatively easily. Or it can dry out relatively easy depending on where you are or what you're doing. And so you're kind of set up for some susceptibility to have some nosebleeds.
So we obviously all have noses.
Yeah.
What percentage of the population do you think deal with nosebleeds?
I can't give you an exact percentage, but I think everybody that I know has had one at some point.
I mean, everybody's had at least one nosebleed in their life.
Exactly. Even if it's just because you got hit in the nose. And so when something is so common, I think people just need to understand the basics of, okay, when do I need to get seen? What do I do? We were talking a little bit before the show of, what do you do when you have a nosebleed? There's some old home remedies out there, or some myths, I guess is a good way to say it, about, pinch your nose, tilt your head back, tilt your head forward, put ice on your nose. And so some of that stuff is really helpful. Some of that stuff may not be helpful. Like if you get a bad nosebleed and you go to the emergency room, the first thing they do is not reach for some ice to put on the nose. And one of the myths of you having a nosebleed at home is put ice on your nose. I think ice on the nose is great if you got hit in the nose, and if we're worried that
that's probably more for like swelling or just pain reduction.
Exactly. So if you do have a nosebleed, one of the first thing we like to do is to try to see if we can get the nose to stop bleeding, if we can get the blood vessels in there to shrink up and constrict. And so there's some good medicines over the counter. Oxymetazoline.
That's a fancy name for?
That's a generic name for Afrin, or it's one of the trained names. There's neosynephrine. Which is a different drug than oxymetazoline. That's available over the counter as well. And a quick thing to do is to squirt your nose with some Afrin or neosynephrine, and then you can even put some cotton balls with that medicine on it, and put the cotton balls on the inside of the nose, and then pinching the nostrils. If the nosebleed is coming from up front, sometimes that can be effective.
So most nosebleeds like that type of treatment, an easy fix, for lack of a better word. I think you would use the word acute. They just sort of happen. There may be one-offs. There might be a trauma, might get hit in the nose or something. Can we talk a little bit about what, other than a trauma or such, what would be some reasons for recurring nosebleeds?
For the simple nosebleeds, like we were talking about, a little bit of spotting or something up front that's coming out of the nose, using some Afrin and some cotton balls and some direct pressure is reasonable. Causes of nosebleeds, it just kind of depends on what you're talking about, really. It can be something very benign, and sometimes it can be something more serious. I guess one question that people always have is, I was sitting here, I was minding my own business, I wasn't doing anything, and all of a sudden, my nose just starts bleeding. Why is that? It can depend. If you're a healthy person, there are things that we think about. If you've got other medical issues, they may be playing a role. Sometimes people can have some underlying problems with their blood. Sometimes people can be on medicines that may promote thinning of the blood if you have a heart condition.
So if you're a high blood pressure or you're taking a blood thinner, those kinds of things would be more of a chronic potential cause.
Correct, but that can lead to nosebleed. And then there's some individuals who are not on any medicines, that haven't done anything wrong, that all of a sudden have a nosebleed. And then, we're concerned at that point, is there something going on inside the nose? If, if you haven't been sick, if you haven't had a sinus infection, all of a sudden you have a nosebleed. We got to look at that, because you can find things that you wouldn't expect, even tumors. That's rare, but that kind of stuff does happen.
So that can be an indication of something bigger going on, or something deeper, maybe.
Yes. Yeah, absolutely. More complicated.
Okay. So if we think about the levels of severity of nosebleeds, really from the simple, I've got a little bit coming out with my snot, for lack of a better word.
Yeah.
I'm the Joe Schmo here, not the doctor.
Right.
That's pretty easy to severe. When do I treat something at home? When do I go to urgent care, emergency room, come see you, a surgeon?
Right. Good question. A bad nosebleed is going to find us. People aren't going to be wondering, what do I do? They're going to end up in the emergency room, or they're going to go to urgent care and get sent to the emergency room, because a bad nosebleed, a severe bad nosebleed, it's a problem that's got to be stopped. There are the nosebleeds that people have after having sinus surgery, where you have a little bit of bleeding down the back of the throat or out of the front of the nose. And once you explain that to people at a time, look, you're going to have a procedure, you're going to have something done, you're going to see some blood, as long as it's not just a tremendous amount. And we, after we have sinus surgery, we're talking to our patients, and we're seeing back the next day. And so we kind of keep a close eye on them, monitoring and getting a feel from them of, are you doing okay, or are you not doing okay? The people that are at home that haven't had that kind of preparation, when do you come in? It just depends on how bad the nose is bleeding. If you have a little bit of drip here and there, it's not terrible. I think that can be seen at a time that's convenient for the patient. But if you have a bad enough nosebleed, no matter what time of day it is, you're going to get seen by a medical professional, and eventually an ENT doctor is probably going to get called.
We've talked a little bit about the myths of treatments, and we've talked about the Afrin spray. Are there any things that I can have at home that I can help to treat nosebleeds if something were to come up?
There are some newer products in the market. I was told, I haven't seen in the drugstore, about some powder. It is similar to the idea of combat, where people have some kind of an injury and they put some kind of quick clot powder on there. I haven't seen that in the drugstores, or that's available, not commercially, but available for the general public. I haven't seen that. I've heard stories that they were going to come out with something like that. Again, I think the old standbys are the things that are going to not get people in trouble. Something to decongest the nose, make the blood vessels shrink up, like Afrin, cotton balls. You can even lubricate the cotton ball with a little bit of Vaseline. We talked a little bit about the show about prevention of nosebleeds. There are people who are kind of predisposed to have nosebleeds. Usually if you're using a CPAP machine, the CPAP is continuous positive airway pressure. That's a machine that blows oxygen into the nose, into the mouth because of sleep apnea. Those individuals that are on CPAP generally can have some dryness to the inside of the nose, and whether you use some saline drops or there's some saline gel that's available over the counter that you can use. Plus, we talked about humidification. Hot steamy showers. Some of the CPAP machines will have humidifiers on them as well. Sometimes I'll get asked about, having a humidifier in the room. I don't know how effective those are. In a big room, having something over in the corner that's putting out some kind of moisture, I think it's better than nothing. Down here in Mobile, Alabama, we get a lot of rainfall a year, so usually it's pretty humid here most of the year. I think the people that travel to the mountains or out west when it's really dry will have more of a problem.
Well, I was going to say that changing in climate, even here in Mobile, which is, I think they say, the rainiest city in America, we are used to humidity. But in the wintertime, it dries up a little and gets cool. And so I even notice my nose starts to get dry. I can imagine if you go to the mountains of Colorado from, tropical Alabama, that your nose is going to be in shock a little bit.
Yeah.
So what can I do when I do that? Do I take like Afrin or just again take hot showers?
The moisture. The Afrin is good if you're having a nosebleed, but if you're at altitude and you use some Afrin in your nose and you shrink down the nose, the blood vessels, and you shrink those up, you may make the dryness worse.
Okay.
Because you're going to get you're shrinking the nose down. The nose is going to be less congested, so more of that dry air is going to get further up in the nose and the nasal cavity. I think if you're having a nosebleed, you've got to use it. But the main thing is to try to keep some moisture inside your nose. Steam works great, and the hot steamy shower seems to be a cost-effective way to treat that. One thing to kind of mention here is, if someone does come in with a nosebleed, how do we go about treating it? Mm-hmm. I think the first thing you got to do is you got to look in there and see where the blood is coming from. It can be very frustrating for patients when they come to the office and they say, I've had all these nosebleeds, they're not bleeding now, and you got to look in the nose and you got to try to figure out, okay, where's the nosebleed coming from? And that's when we use the endoscopes, the endoscopy equipment we talked about in previous shows. We'll look inside the nose to try to see where it's coming from. Sometimes I'll even get CAT scans. We'll take pictures of the sinuses to see and make sure there's not an infection or if there's not a mass or a tumor or something like that. If it's a child, a lot of times they don't really tolerate looking endoscopically in the nose in the office that well. And so depending on the frequency and the severity of it, we might decide, okay, we're going to go to the operating room and drift off to sleep for a few minutes so I can look in the nose, try to figure out where it's coming from, and maybe cauterize the area. And so we use that term cauterization. And so what that really means is we're trying to get the blood vessel to stop bleeding. So we're burning the blood vessel, either with a chemical where we try to seal the blood vessel, or with electricity where we actually touch the blood vessel and to get it to stop bleeding.
And is that a permanent cauterization?
It can be. It depends on what the situation is and what the reason why you're having the nosebleed to begin with. Some kids, if they have a lot of allergies or if they're rubbing their nose a lot, or children sometimes tend to pick their nose a little bit. If you're having a trauma or chronic inflammation there, the nose may tend to regrow the blood vessel. That's rare, but it does happen. So there's some kids that I've treated over the years that I've had to take back to the operating room more than once. Usually when you're doing that, you want to look in the back of the nose to make sure there's no tumors, there's no masses. You always try to screen people and ask and make sure they don't have any blood problems or any other medical problems. Sometimes if you're having recurrent nosebleeds, there may be something else going on that's not so readily apparent. And sometimes it's a little bit of like a detective. You're trying to figure out, okay, where all this is coming from. For an adult, a lot of times we can do this right in the office. We can look in the nose and see something and cauterize it, because adults you can talk to and they understand kind of what you're doing. In more complicated cases, you may have to go to the operating room. And there's sometimes, depending on how healthy the individual is, that we even get some of our radiology colleagues, our interventional radiology colleagues, to do something called an embolization procedure, where they can actually take a catheter running through the groin, through the blood vessels up through the groin, all the way up into the face, and then selectively target those areas that are bleeding and put some medicine in there or a device in there to shut off the blood flow to that artery. And that's very, very complicated. I think the overwhelming thing that I want people to take away from this show is that, when you do have a bad problem, like a nosebleed, it can be very frustrating, because at one minute you're fine and the next minute you start to have this nosebleeding, and you can end up in the hospital, and then people can be talking to you about having to pack your nose or have surgery even. And so that's rare. That's really rare. That's not the majority of people, but it does bear discussion.
So while nosebleeds are a common problem, there certainly are levels of severity of them, and those that are the most severe are not as common.
Correct.
So wrapping up, because we've had a great discussion about nosebleeds, which is something you deal with all the time, and all of us as humans have dealt with most likely at least once in our lifetime. If anybody has any questions about nosebleeds, they can give you a call and reach out to you at your office.
Yes, we're taking some appointments on the website as well. My office number is 251-470-8823. I've always got to repeat this because I say it so fast. So it's 251-470-8823. And of course, we have appointments on the website. It's drronswain.com.
Great. Well, is there anything else that you would like to share about nosebleeds?
No, I think that's everything, Stacy. It's just one of those topics that we just got to cover, and it's a common topic.
It certainly is. So thank you for sharing that today. And if anybody has any questions, feel free to reach out to us, and we'll address it in an upcoming show.
Thank you.
Thank you. Thanks for listening to the Swain Sinus Show. Please subscribe to our show on iTunes, Overcast, and anywhere you download your favorite podcasts. Want to know more about Dr. Swain or to schedule a consultation or appointment? Visit SwainSinusShow.com or call his amazing nursing staff at 251-470-8823. We would love to hear what you think about the show. Email us at drswain@drronswain.com. Again, thanks for listening. Breathe easy and have a great day. This show is brought to you in part by the fine physicians and friendly staff at Premier Medical Group in Mobile, Alabama.